I agree with trying to keep services local. As an older person, travelling long distances for appointments is difficult.
Yn glinigol, gofal yn y cartref sydd orau ar gyfer y pobl hŷn nad oes angen triniaeth feddygol acute arnynt.
Prevention and early intervention is essential if a community-led NHS is to succeed.
Cyflyrau cronig. Mae pobl yn mynd o gwmpas mewn cylchoedd. Mewn a mas o'r ysbyty, dyw'r cyflwr byth yn cael ei reoli.
For many years you've told us how you want to see more services delivered closer to home and to where you live in your communities. The vision for the Health Board is to do just that, delivering 80% of the services that we currently provide in a local community or indeed in your own home. For us it's about investing in primary and community services and investing in a sustainable healthcare model that actually adds years to life and life to years. One where the quality of the services that we provide is second to none, world class, and where the services are easily accessible for the population of our 3 counties.
Did you know that by 2031 the number of over 75-year-olds will have doubled, and that currently the over 75s occupy 70% of the hospital beds within Hywel Dda? Older people are more likely to have long-term illnesses, meaning more people needing more treatment for longer.
Did you know that already 1/3 of adults in Wales have at least one chronic condition, such as asthma, diabetes or arthritis, and that conditions that were once untreatable are now treatable, further increasing demand for our health services?
Did you know people often believe that hospital is the best place to receive quality healthcare? And yet, a recent survey showed 40% of patients in hospitals in Hywel Dda do not need to be there to get the care they require. These days, a lot of care can be better provided in the community, as these patients have told us.
The art team made all the difference. I mean, it enabled me to come out of hospital, get back home, which is the boat's my home as far as we're concerned. There's no doubt that you recover better in familiar surroundings. I mean, the hospital is a good place to be fixed up, but there's no place like home when it comes to recovery.
I've got a chronic lung condition, and the telehealth device has helped me understand my condition, and it also helps me liaise with the respiratory nurses should I need them. And through that I've controlled my own disease basically, and I don't need to have any admissions to hospital. If I have to go in, it's just as an outpatient for a day, just a check-up. And as it is, I can just get on with life instead of travelling back and forth to the hospital.
Giving these patients care closer to, or even in their own homes, is not only better for them, but it ensures more hospital beds are available for those people who need the most intensive care when they need it. The reasons why change is needed are clear, and no change is not an option for us.
There are a number of reasons why the NHS needs not only to change but to be transformed. And I think we need to start looking at the NHS in a different way and the sort of services that can be provided in a different way. I think what we've done in the past is always equated the success of the NHS with the number of hospital beds that there are. And because of the increase in new technologies and the way that services can be delivered in the communities, I think we need to stop doing that and to look at the quality and safety of services wherever they're delivered.
The NHS needs to change because medicine is changing very rapidly. The pace of discovery is increasing every day, and if we don't keep up with it, then we don't provide our patients with the best possible services. Inevitably, this means building teams of people to provide the very best of care, because it's not just the technology, it's also the skills that are required to get older people through more complicated surgery and more reliably. And in that way, we're able to cure a great number of people who have cancer of any sort, whereas in the past they would have perished.
By investing more money in primary and community services, particularly for those individuals with long-term conditions, and working differently with partner organisations and the voluntary sector, we'll be able to keep more people at home longer where they want to be. These changes will greatly improve the quality of the services that we can deliver and will bring services to the heart of our community where people want them. To deliver the world-class health system that we want, we need to be bold, to do things differently. And that's part of what this exercise is about. It's to ask you to help us to deliver a service that you want to receive in your communities and delivered in a different way.
Appreciations from patients has been absolutely fabulous. Everybody is very much for the service. We've waited a long time in Pembrokeshire for the service to come, but everybody is very grateful for the care that they've delivered and having access to 24 hours nursing care in Pembrokeshire.
We've listened to what you've told us. We've listened to what our stakeholders have told us. And we've listened to what our clinicians have told us. And this is what the experts have to say.
The way that we deliver healthcare these days is very different to the way we delivered it 20 years ago. Far more can be done within the GP surgery or in the community compared to several years ago. An example is dermatology, people with skin problems. We want to develop the GP with special interest service and community and telemedicine service to enable them to receive care close to home. The traditional model was that patients went to see a consultant that may be at many miles from where they were living. They will now be able to see a GP based in a surgery very close to where they're living, but it'll mean that they'll get the necessary treatment a lot quicker as well.
Well, at the end of this process there will definitely be 4 hospitals, and I know it's difficult for people to think of their hospitals functioning in a different way, but they will be different. And that is because we have many challenges that we need to address as a health board actually for patients to make things better for them, which means that we need to have enough of a concentration of both staff and patients in one or more areas that actually addresses 3 things. The first of which is making the positions attractive for recruitment and retention of staff. Also to address the educational standards that we need to make for our trainee doctors, but also and crucially achieve the national standards that we are being set to deliver for quality and safety.
When we think about women and children, we're trying to develop the service and make it even better than it is now. So at the moment we have babies who are born with difficulties or who land up in difficulty with their breathing, for example, and instead of being able to care for them within the boundaries of the whole of our health board, they have to be sent to Cardiff or Newport or even further afield sometimes. Hopefully by having a new neonatal unit we'll be able to stop that happening. For women who have no problems during their pregnancy and they're not predicted to have any problems during the delivery, then they will still deliver either at home with their care being delivered by their midwives or in their local hospital.
We wish to deliver patient-centred care, and the patient is at the centre of every discussion and every plan that we make. I can assure patients that when we change services, the service will be as high a quality as possible, the service will be sustainable and will be modern, and undoubtedly we will put patients first.
At the moment there are times when people wait for tests for too long a time. What I want to do is for our doctors to be able to, when they request tests, for them to be able to get the test for the patients much quicker. And this will mean that they get a diagnosis quicker and therefore they'll get their treatment more quickly.
Changes need to happen to the A&E departments so that the essential backup services are present on each of the sites which has an A&E department. Essential services are critical care, acute medicine, laboratory services, lab diagnostics, orthopaedics, paediatrics and general surgery, and it is really essential that these are all there in the background for an A&E department to work properly and safely.
I'm very proud to be chairman of Howell Health Board, and we have started looking at ways to help you live longer and healthier, and we make these 10 healthcare pledges to you, our population, aimed at reducing smoking, drinking, obesity, cancer, heart disease and stroke, as well as other long-term illnesses. But we cannot do this alone, and we need your help to succeed. We have already improved community services, and we are working much closer with our GPs, local authorities and the third or voluntary sector to deliver better patient care. The aim of our health board is to change from being a sickness service to a wellness service that helps people stay healthy. But again, we need your help to succeed. We are trying to make it easier for you to have your say on healthcare matters that really interest you. We want you to get involved, so that you can live healthier lives, but also help us improve healthcare services across Hywel Dda. Together we can make sure we have the right services in the right place at the right time every time. Your views are really important to us. This is about your health and well-being and your future. Diolch yn fawr iawn. Thanks very much indeed.